Assalamualaikum warahmatullahi wabarakatuh and good day everyone. My name is Amira Idris and with me today are Sister Nurul Shafiqa and Brother Alif Rahimi, and we are representing J12 cluster, which includes Mahallah Sumayyah, Mahallah Nusaibah and Mahallah Salahuddin, and we would like to proudly submit to you our proposal on introducing peer-assisted art therapy in IIUM. Next slide please. The following are the content of our presentation. Next slide, please. And this is the mission and vision of our project. The mission is to allow students with all background and walks of life to enjoy an affordable therapy through active art making. And we based our mission on the vision in order to realize the targets set in IIUM Suggested Academic Framework. Next slide, please. In this definition of art therapy provided by the American Art Therapy Association, it provided that art therapy is an integrative mental health and human services that is provided to enrich the life of individuals by way of active art making, creative process, and applied psychological theory. Additionally, next slide please, in the definition provided by the Malaysian Association of Psychotherapy, art therapy is described as a mental health profession that uses creative process in order to help individuals to resolve conflicts, resolve problems, develop interpersonal skills, and to manage behavior, reduce stress, and many others. Next slide, please. Art therapy is conducted by art therapists. Art therapists are clinicians who work with people of all ages guided by ethical standards and scope of practice. And art therapists work with not only with mentally challenged individuals or individuals facing mental health issues, but also individuals who seek emotional and creative growth. Next slide, please. Art therapy is way beyond treating psychological distress and mental disorders. Art therapy can also be provided to individuals suffering from medical conditions. For example, in the slide as shown, art therapy is suitable for children with learning disabilities and also individuals suffering from brain injury, in addition to people experiencing mental health problems and individuals who face traumatic events. Next slide, please. Now, based on our reading, we have found that art therapy, which uses creative artistic expression, have clearly shown positive effects to the participants. And thus, we believe that art therapy in our context as IIUM students, not only is art therapy a better way of engaging participants in receiving help mentally, but also as a way for the students to talk with each other and to engage in conversations with one another. And thus, I now pass the floor to my partner in order to explain more on our execution plan.
For the execution plan for the proposed program, we will start by introducing the management of the program. So, as shown in our slide, we post that this program, Art Therapy, will be organized by the MRC members situated in IIUM Gombak campus. All of the MRC members in IIUM Gombak campus will be involved because we want every Mahallah to take turn on organizing and coordinating the session. Since the session will require an expert that specializes in art therapy, we would like to collab with Mental Illness Awareness and Support Association, MIASA in short. MIASA, who is founded by Puan Anita Abu Bakar, is an NGO that has close relation with IIUM in conducting programs and activities related to mental health well-being, support, and training. We would like to also train all of our MRCs so that we can increase the capability of the MRCs to help the therapists during the session. For the framework of the session, each fortnight, which is every 2 weeks, One session of art therapy will be held in the Mahallah premise in relationship between the related Mahallah. Each session will use various types of art therapy to expose IIM students to the diversity of art therapy. Each session, maximum of 15 students will be participating in the session led by 1 to 2 instructors, and maximum of 2 hours will be set for the duration of this session. These are the proposed module, which we will have 6 weeks that full of the module which relate with the art therapy session. And for the cost estimation, we'll be focusing on 2 parts, which is art therapy session and the art therapy room and art materials. Art therapy session, each art therapy session will cost 250 ringgit. And according to the previous slide, we will have 6 art therapy sessions, which will have a total cost of 1,500 ringgit, 1,500 ringgit. MRC note that MRC and students volunteers will attend the art therapy session for training. The program will be conducted by MRC in order to sustain the program. And for the art therapy room and materials, we will have to buy 3 bin bags, a diffuser, a display shelf, and a water cushion, which have a total cost of 500 ringgit. And the art materials which will be used in the session, we will buy 4 boxes of pencils, 15 boxes of crayons, 15 color pencils, 15 watercolor set, and a drawing papers, which will have a total cost of 301 ringgit. Total of rough estimation of all of this will be 801 ringgit. And for the location, we will choose Sumayyah Center because we think it is a strategic place which is open to male and female students without worrying any problems. So we go to the next slide, which for the Nushafika.
Thank you, Brother Alif. So, sustainable welfare. The first one is SDG goal, good health and well-being. As we know, SDG goal, the official wording of SDG 3 is to ensure healthy life and promote well-being for all at all age. The target of SDG 3 to cover and focus on various aspects of health, like healthy lifestyle and healthy life. These include the mental health. So with this program, we can achieve the Sustainable Development Goals set forth by the United Nations. The second one is action beyond advocacy. With this program, we can be the first university to introduce and implement the art therapies that can help students who's fighting with mental health issue. The main point of this program is to help them dealing with their mental health issue themselves. For instance, students who have stress and depression, they can express themselves through art therapies. They can heal it with art therapies. Art therapy, sorry. The third one is transfer of knowledge. As we know, MRC, like Brother Alif said, that MRC and student volunteer will attend this art therapist session for training to sustain this program. The fourth one is ambitious collaboration with NGO. As we stated that we will collab with MIASA to train the art therapists among the MRC and student volunteer. Next slide, please. So the benefit for student, first, give other opinion in dealing with their mental health. Next, we will provide student a stress-free activity. The third one is improve student emotion, and the last one is we help student gain awareness. Next slide, please. So benefit for IIUM as a whole, we can improve communication and concentration. Also, we can produce a positive and stress-free IIUM community. Next, IIUM will be the first university that adopt the art therapy as a platform for students to unwind from academic pressure by doing some arts. And the last one, there will be a positive distraction in IIUM that will be available to every IIUM community. That's all from us. Thank you.